Hello and welcome to all of our Gold viewers from around the world. I'm Kristen Schwartz, licensed midwife and one of the MCs here at Gold. And I'm chatting today here with Dr. Isabella Garti. Welcome, Isabella. It's wonderful to have you back here with us.
Yes, thank you so much, Christine, and the Gold team for having me a second time. It feels like home. And yeah, so happy to share and to learn from other panelists also in this
Absolutely.
labor series. Yeah.
Yes, absolutely. You are part of our Gold Labor and Delivery Symposium this year. So exciting about this. And your presentation is titled Optimizing Clinical Management of Pre-Eclampsia During Labor and Birth. Such an important topic. And we get to that in just a moment. First, I want to ask you about your background. You are a midwife, a researcher. You are wearing so many hats, and you also, preeclampsia is one of your passionate topics that you have researched and worked with or in for a very long time. So tell us a little bit about your background.
Yeah, so I'm a midwife and originally I'm from Ghana. So in Ghana, I have worked across the health system. I have worked in rural areas, but I've also worked in the largest tertiary hospital in Ghana.
Mhm.
In the last, let's say, 6 years or so, I was involved in educating undergraduate midwifery students in Ghana. And in the last 4 years, I embarked on a PhD here in Australia. So I currently live and work in Australia. Um, my research is around preeclampsia management,
Mhm.
and I'm focused on how midwives can improve the care they give to women who experience preeclampsia from a low and middle income country setting.
Mhm.
It's been a learning curve for me. I've learned so much about preeclampsia. I've learned so much about the resilient midwives who are doing so much with so little. I've learned
Mhm.
how they are passionate in trying to improve the care for women to make things better. And we are trying to see how we can implement some of the findings from my PhD and train midwives in preeclampsia care using what they have and what they've already been doing, but trying to strengthen that and make that better. So yes, that's just a little bit about me. Currently, I work at the Molly Wadaguga Research Institute here at South Darwin University, where I'm a research program manager. I am overseeing many different projects in Aboriginal maternal health. And yeah, that's also something new that I'm involved with at the moment.
Beautiful. You make such a contribution to the community, to research, to the field. It's absolutely wonderful to see. And it's something you mentioned earlier that really spoke to me, strengthening the midwives and birth workers in the field where they are in the low resource areas and work with what they already have, because many of these midwives and birth workers, nurses, they have such knowledge and such passion. They work with so little, right? And giving them the tools they need to really, really succeed is so important. Um,
Exactly. And that is why, especially when it comes to preeclampsia management, it's about going to the basic.
mhm,
It's the midwife's ability to recognize. That is the
mhm,
cornerstone in terms of preeclampsia care. Sometimes it's not even about the things that we do after, but it's just about recognizing, not having that missed opportunity, to
mhm,
recognize that, hey, this woman is having preeclampsia. Because once you do, it's a game changer. That's what's
mhm.
going to save her life.
It is a game changer. And, preeclampsia is something that we have been recognized or worked in curing for a long time now. So I wish we were, and that must feel like really close to your heart too. I wish we were further along, right? With all the knowledge that we have. But education is a big part of that. And I was wondering about one thing, Isabella, is how as healthcare providers, nurses, midwives, can we do also a better job of educating and empowering women about and telling them and educating them about preeclampsia and about the warning signs, so they feel but also empower them that they feel confident enough to speak out and speak up to their care provider. So in many situations, many women feel like, oh, I can't speak up, or what I'm
Mhm.
experiencing is just normal pregnancy, things, headache, that's supposed to be normal. Yeah, I don't feel good, but I'm told this is normal. So many women, we need to educate them better so they know, okay, this is really something important to look out for, and also to speak up. And also the healthcare providers, we need to do better also to listen to the women.
Yeah, you've said it all. The thing is, midwives spend the most time with women. In fact, it's very interesting that in many low resource settings, they are the majority healthcare provider.
Hmm.
So once the woman enters the health system, she's likely to come across a midwife. And so that's our opportune moment, to get
Hmm.
to know the woman better, to listen to her when she's telling us what she's experiencing, but also to take note of those subtle cues that they may be, giving. However, we can't give what we don't have.
Hmm.
So it begins with the midwife herself,
Hmm.
knowing what pre-eclampsia is and being able to explain that to the woman in a way that the woman will understand, in a way that she'll appreciate, not
Hmm.
only to the woman, but also to her partner and to the family. Because sometimes when I'm sick, for example, my husband is my advocate. He does,
Right.
I may not be able to speak for myself, but
Right.
he could do the speaking on my behalf. So it's
Right.
about educating women, their partners, their families to know the signs and symptoms and to know the urgency with which they must
Urgency.
come to the hospital. We can
Hmm.
only do so much if you stay at home, but we
Hmm.
can do a whole lot more if you come to the hospital on time, and
Hmm.
then we can care for you. Because pre-eclampsia is such that you need to be in hospital, you need to have these drugs carefully administered to you, you need to have laboratory tests done, and we can't do that in your home. So
Hmm.
it's about midwives even knowing, attending workshops, getting training to know what preeclampsia is, to appreciate the risk, and also
Hmm.
to know that they are the number one providers of maternity care and they can do so much.
And good, yeah, very wise words there about the urgency. It's very important to recognize the urgency of the situation. Talk to me a little bit about some unique challenges in managing preeclampsia during labor and birth in low income countries, and how can these be best addressed?
Oh my God, Christine, the challenges are just enormous. But let me just bring it down to two main things. As I keep saying, it's about recognition. For some
Mhm.
midwives, when the woman comes in labor, they are just thinking of how do we get the baby out? How do we help this woman have a baby? And sometimes all our efforts are just directed towards the birth, and we are neglecting the other things also.
Mhm.
And that is where collaborative practice and also drawing on the more experienced midwives on the labor ward comes in, and it's really important. Because sometimes when you are caring for the woman alone in your tiny bubble, you may forget the other things or may not realize the other
Mhm.
things. And so drawing on experienced midwives in your team is really important. But another thing also is that in labor, things go really, really fast. And
Yeah.
so midwives need to be prepared. You need to have your emergency tray for preeclampsia management with all the drugs. You need to have your magnesium sulfate at hand. You need to know your emergency contacts. You need to be able to work really, really fast because when it does occur in
Mhm.
labor, it can be really, really fast. And before you realize, we have lost a life. And so these are some of the challenges when it comes to pre-eclampsia management in labor in particular that
Mhm.
we have realized in low and middle income settings. Yeah.
Well, thank you for that. So you work in research, and this is so important. And I feel like we need more research. We need more research. We need more midwife researchers. We need more nurses and research, right? So from your point of view, what you're seeing now, what do you see as a future direction for research on the management of preeclampsia? What do you see? Where is the journey taking us in your field?
The research in terms of preeclampsia management needs to be focused more on improving the quality of care. When
Mhm.
I started to research midwives and preeclampsia management, I found very little published research that shows midwives' involvement and midwives' knowledge with preeclampsia care. We need more research across the world showing how midwives care for women with preeclampsia so we can identify the gaps, then we can know what to strengthen. Because the scopes of practice are not the same. How midwives care for women in Australia is not the same as how midwives care for women in Ghana. So we
Mhm.
need all the research so that we can have a clear picture of midwives' involvement. Then we
Mhm.
can know what are the gaps and how can we make it better? Because midwives are doing a tremendous job. We are
Mhm.
not just doing research out of vacuum. We know
Right.
that they are doing a tremendous job. but how can we make it better the world over? And also, we need to have more patient or more woman-centered research. We often neglect the experiences, the
Yes.
knowledge, the perceptions of women and their families. And
Mhm.
we can't have a complete picture of preeclampsia if we don't involve the one who is experiencing it. What is the emotional toll that comes with this? What is the burden to the family, the financial burden to the family? In low resource settings, many women have to pay out of pocket. They already can't afford to have a meal. So what is their motivation to come to the hospital and spend so much? So the research needs to focus more on midwives and also on the woman and her family.
On the woman and her family. I love that. And I hear the passion in your voice when you talk about this subject, Dr. Isabella Garti. That's absolutely fabulous. Before I let you go here, any final words for our viewers here?
Yes, I want to say that preeclampsia, it doesn't look like it's going away anytime soon. Over 500,000 women are losing their lives on a yearly basis to preeclampsia. This means that this is something that is urgent, this is something that is serious, and it demands all our focus and attention. Um, I urge your viewers to keep logging on and enjoying great content from Gold, but also learning more about preeclampsia and its management and other hypertensive disorders of pregnancy. Because when we are armed with knowledge, we can do so much and we can make a real difference in the lives of women. And thank you for having me once again.
Thank you so much, Dr. Isabella Garti. We're looking forward to the presentation, Optimizing Clinical Management of Preeclampsia During Labor and Birth. This presentation is part of our Gold Labor and Delivery Symposium 2024 that will be available in October. We have a live open access keynote presentation also available. So to our viewers now, if you find this interesting and would like to find out more, please visit goldlearning.com. You'll find all the information on all the presentations there as well. Thank you again, Dr. Isabella Garti, for being here with me today. And thank you to all of our viewers. And I hope to see you at the symposium. Bye-bye, everyone.